Hi, everyone. Welcome to the Voz podcast. Today, we are lucky enough to have a guest. We have Dr. Mubin Syed. He is a nationally recognized physician with almost 30 years of experience. Joining us today from the US. He's got a very interesting story about how his personal experience, his personal health experience, has impacted the work he's doing now and led him to wanting to educate South Asians on their health. And as you know, the Avaz podcast is about talking about medical issues and concerns that impact both South Asians and South Asian women. So we're really excited to welcome you, Dr. Syed. Thank you for
Thank
joining
you.
us. We have
Pleasure to be
Dr.
here.
We're very excited. I mean, we've seen you on Instagram, on social media, have quite a following,
Yeah.
and it's
Thank you.
great to be able to share this platform with you and talk about some of your findings. But first of all, I would like us to hear a little bit about what your background is and what brought you to want to talk about South Asian health issues.
Well, I'm a physician. I work in vascular medicine or vascular health, uh, involving blood vessels, and also I have some subspecialty boarding in obesity medicine. But my profession is I'm an vascular and interventional radiologist, where I do try to open up blocked arteries and different structures inside the body. What sort of led me to this area was I was aware that people of South Asian heritage were having high rates of diabetes and heart disease, but I kind of thought it's probably because they're not following healthy habits. Their lifestyle was not healthy, and perhaps that would be responsible for that. And I thought, oh, this couldn't happen to me. I don't have a family history. I exercise every day. I, you know, control my blood pressure and this and that. And I thought I was doing everything that you would expect. I was trying to eat healthy, etc. And I didn't smoke. And I was really, one day I was exercising and I I just felt really anxious and I was of course sweating, but I had just worked out, so I thought, okay, it's probably just post-workout. I thought I was dehydrated, and I wasn't even having pronounced chest pain. And I thought I'd just go to the emergency room. They checked my vitals. They said, yeah, your blood pressure is a little low, 110 systolic, not super low, but I thought, okay, great. Well, they're going to give me some intravenous hydration, and I'm going to feel great after that. Um, and lo and behold, they're giving me a baby aspirin, and they're showing, and of course they do an EKG, and they said you're having a STEMI, which is the most serious form of heart attack. And I was like, no, that can't be. I mean, this must be a mistake. I don't even have the right symptoms. It was such a big surprise that I was having basically a massive heart attack. And they rushed me to the cath lab. An intervention cardiologist found two blockages. One was a total blockage and opened them up, put three stents in. And of course, I felt better right away after that. But it was kind of a surprise and a very scary experience. And it sort of blew my mind to know that I had a heart attack with no family history.
No
And
family history, you're only 53, and you've been doing everything right, according to you, the
right,
exercise, the eating well, maintaining your general health.
I was even low risk on the standard risk estimator. Um, I thought, you know, there's no way I could be having this. I'm low risk. And that's when did a deep dive. I said, like, I questioned everything that I had known about anything regarding
Mm-hmm.
my own health. And I started really researching, and it was an eye opener for me to learn what I learned. And then I wanted to also go beyond that, and not just understand that we have some unique health um, practices that we have to follow as a South Asian, as an ethnic group. I wanted to understand what happened perhaps in our history that made us so predisposed compared to any other ethnicity.
Yeah, it is. I mean, you're absolutely right. I'm sorry that you had to go through your personal health experience to do that deep dive. But I mean,
Hmm.
the information that you've shared in your book, Healing from Our History, and in your Instagram and your TEDx talks has been invaluable. So I'm really glad we're able to
Thank
share it
you.
with our listeners. So thank you.
Yeah, yeah, my pleasure. It's really, it's sort of my pain, but I was able to turn it into something positive to help others. And I hope that this can help other people from going through what I went through.
And
Yeah,
so
I think.
some,
Sorry,
sorry,
go
I was gonna
ahead.
say just
No,
some of
no.
what you found was that South Asians are more predisposed or more likely to get diabetes and heart disease, more so than the average North American person.
Yes, four
They're
times
getting it
higher.
earlier, they're dying earlier, and
Yes,
sometimes the symptoms are missed in South Asian women. Is that correct?
that's true. 50% of heart attacks occur before the age of 50. 25% of them occur before the age of 40. A lot, and people are dying at a 40% higher rate compared to the standard population. It's a very serious problem. Uh,
It is just recently in Edmonton. There was I don't know if you heard about this in the news, but it's all over in Canada. A young father of
yes,
three
I'm
children. He
familiar.
was 40 something. Yeah,
Hmm.
and I mean it's because there is and this is not to address blame because I don't know what exactly the medical situation was, but for someone who has what they said is 8 hours of chest pain and very intense chest pain, and then to
Yes,
die in the ER is
right.
just gives me goosebumps. It's just horrible. So I think that there has to be an awareness also in the medical system
Hmm.
that just being South Asian alone should increase that risk factor
Yes,
in a whole different way.
because our community is undergoing a health crisis. I mean, it's a veritable health crisis. This is what the UN calls it. And there should be an awareness that when someone of South Asian heritage shows up in the ER, especially with, you know, chest pain,
Yeah.
it needs to be investigated aggressively,
Yeah.
and
And
assume a
in
heart
women,
attack or
yeah. And
something,
in women also, as a primary care provider, I have to be very in tune with the kind of symptoms they're coming with, which are completely can be very subtle. It could be
Yeah.
something as oh, didn't get used to get short of breath going up the stairs, just getting a little bit more. And instead of
Yeah.
attributing it to deconditioning, which
Hmm.
is a factor, but
Yeah.
you do have the onus to investigate them to say, hey, well, maybe you're getting short of breath because your arteries aren't getting enough oxygen and there could be something else going on. Or that
Yeah, totally.
heaviness, let's not just say it's indigestion, let's investigate it for other things. So you're right, there's a lot of
Hmm.
subtleties and nuances, especially in South Asian health, men
And
and women.
Yeah.
exactly, and not only that, but South Asians I find are more likely to sort of push away those symptoms and just keep doing what they have to do, fulfilling their responsibilities and think it's okay, my stomach might be upset, or I'm just a little nervous, or they explain away their symptoms and they're not doing themselves a service by doing that.
True. Yep.
And we're going to have
Exactly.
to, Dr. Syed, talk about this. I know you're going to ask this question, Rupinder, but the amalgamation of multi health risks in us makes us even higher risk for heart disease. So if we have the high
Yeah.
blood pressure, the diabetes, and all that stuff, but I'll let
Hmm.
you ask
It
that question,
compounds.
Rupinder.
Yeah. I'm going to start with what is metabolic syndrome?
Yes, metabolic syndrome, something that is very commonly found in South Asians, is it's a cluster of risk factors that travel together, and they dramatically raise your future risk of diabetes, heart disease, stroke, fatty liver disease. The common engine is insulin resistance plus having a lot of what's called visceral fat or fat between the organs in your belly and your abdomen. And that's the main thing, having a wide wider than expected waistline for a South Asian, and then having two of the following: high triglycerides, or low HDL, high blood pressure, elevated fasting glucose level. And this is what's called metabolic syndrome. And it's really it's a risk for future, problems.
And how do you test for that? How do you know if you have any of those conditions?
Yeah, so the major thing is checking the waist circumference to start out with. And South Asians actually have a lot more stringent requirement in terms of their waist circumference. It's a lot narrower than it is for, like, say, a white population. We have to maintain, I mean, the cutoff for being diagnosed by the International Diabetes Foundation for metabolic syndrome is for a South Asian a male greater than 90 centimeters and a female greater than 80 centimeters. So it's surprising that's relatively low.
And that's the waist size.
Just the waist
Yeah.
circumference. And then, of course, you want to check blood pressure. If it's 120 over 80 or higher, that's considered high blood pressure. Fasting blood glucose or hemoglobin A1C, checking your lipids. If these are also elevated, you just need two of these other factors to be diagnosed. And that's how you can diagnose someone. It's not that technically advanced to diagnose it. You can almost tell that someone has it because
Yeah.
a lot
Yes,
of
you
South
can.
Asians store their fat around their belly.
So that sort of, can we call it the apple shape for our listeners? First, do you believe in that whole apple pear thing or not really?
No, I agree. I think that the apple is definitely higher risk than the pear.
Yeah.
In terms of, yeah.
Just
And but that
appearances.
is referring to your body shape, right? Where
Yeah.
everything you're more rounded in your middle than
You're carrying
the
everything
normal
sort of
body.
there. Yeah.
Yeah.
Yep. And then the other thing I would say is, there are some add-ons for cardiovascular disease that should also be tested in South Asians. The ApoB level, that's a very important test. It's sort of better than actually checking the LDL level. It's much more specific for South Asians, and it's much more sensitive for measuring the bad particles that are circulating in your bloodstream. The measuring the C-reactive protein in your body, which is like a marker for inflammation, and also checking lipoprotein small a, which is another specific protein that predisposes you at high risk for heart disease or stroke. That's much more common in South Asians. Specifically myself, I have that problem. And homocysteine levels.
And how do you test for these? Is this like a blood test you
It's a
get
blood test, exactly.
for
Yep.
all of them, except for the
Yep.
measuring of the waist?
Yeah,
Right.
and in Canada, you do, although we have, coverage of our healthcare system, those tests, some of them, especially lipoprotein A, you do have to pay for. Sometimes a cardiologist can get around it and you don't have to pay for it, but if someone just wants a basic screening, it's not very expensive. I got mine done. I had to pay for it. It was fine.
Mhm.
But so it is important for your health. I think it's worth it.
Yeah, definitely.
I think it's even important for us to note in our show notes what these tests are that we should make sure that we get included
Yeah, we
to see
will add that.
if as a South Asian we have metabolic syndrome. It's fascinating that that, as you say, these travel together, the potential for diabetes and heart disease and
Mhm.
fatty liver disease, that somehow, for some reason, South Asians have this almost bad luck. But I know from what you've talked about on your Instagram channel and in your books, it's because of our history of famine
I
coming from
believe
back in India.
that is yes, this is what I believe in my theory, that there's something that that was at one time was survival
Yeah.
um, beneficial. It was very beneficial to our survival to have these traits. But then in an environment of abundance, this is now backfiring on our community.
Right. Yeah. And not only that, when you think back, when our grandparents or our parents grew up in India and they were eating healthy food, or
Yeah,
even if they were eating sweets, they were working really hard physically. They were exerting themselves and they were using those calories. Here we
yeah,
think, oh, I can have a laddu or a jalebi or eat a couple of samosa and because we ate them
right.
back home, but we're not physically exerting
No,
ourselves like that.
it's a big
No,
difference.
it's a huge, huge difference. What I do like with all this abundance, there is now an awareness in my South Asian population that I see a fatty liver, and I was hoping we could talk a bit about that, and
Yeah.
especially about the skinny fat, because I definitely see it in my population where you'll have women come in and they're quite skinny,
Hmm.
yet they have fatty livers. So let's
Yes,
talk a little bit about that.
right. Skinny fat means like you're thin on the outside, but you may have a significant amount of fat on the inside. Uh, Even may have a normal BMI, but you have high amounts of fat inside your liver, for instance, or even between your organs called visceral fat. It's often associated with low muscle mass and insulin resistance. Um, South Asians have this much less capacity to store fat underneath their skin. Um, and so what happens is that this overflow goes into between the organs or inside the organs, and it causes, high risk for, you know, diabetes and heart disease. So the BMI can actually lie, you know,
Yes.
the waist circumference and the labs will really tell you, and there's ways to screen for that, of course.
Yeah, I think we are moving away more from BMIs to
Yeah, I
better
agree.
better parameters. I've never been a big fan of BMI
It does a
myself.
huge disservice to South
It
Asians,
it is,
unfortunately.
it is.
Yeah. So just
Hmm.
because you're skinny on the outside does not mean that you're skinny on the inside because your organs and the fat you're storing could be the same as that of a heavier person,
True.
a overweight
Yep.
person. Yeah.
Hmm.
Yeah, it's actually
So
surprising. It's deceptive.
it
Yep.
is, I know. I'm going to ask you this question because I did this for years. And I think I'm still kind of doing it. Intermittent fasting. Does it work for South Asians? Does it work for women? Like, what an
Yeah.
intermittent fasting is where you just limit your food intake for the day to whatever,
Hmm.
7 or 8 hours. So you eat your first meal of the day, maybe mid-morning, and your last meal of the day, early evening. Does that work?
Yeah. I mean, people also call it time restricted eating. I think it can work if someone reduces your overall calorie intake and you have a healthy diet, you know, despite that. And you can improve your insulin resistance by, you're allowing your body to lower the insulin levels naturally um, through a better timing of your meals. I think it can improve some markers like glucose levels, and it can even improve your insulin sensitivity in some groups. But I think the results kind of vary. Um, for some women, it may be beneficial, particularly if you have PCOS, um, and it may affect not just or improve not just your insulin resistance, but it could also improve your hormone parameters. But I think we need more long-term trials or larger trials to study this specifically. Um, and I think really it's, you need to focus on more than just the timing. I think there's other factors that need to be improved here, like strength training, um, making sure the diet is balanced, perhaps, making sure there's enough protein in the diet,
Hmm.
exercise, activity levels, stress reduction. Um,
Yes.
those should also be taken into account more than just the timing of your meals. You need to, if you're going to, it should be a package.
I also think you touched on something really important, which I think a lot of women, and this is a generalization, but in our community, don't do is strength training. I think strength
Hmm.
training is so important and so underplayed. It's more cardio, but I think strength training is equally, if not just as important, like we're more
Yeah.
important. And I think a lot of women that I talk to, like I'll say, oh, well, you have to do this and how many minutes of exercise. And I was listening to your TEDx
Yeah.
talk, and I was a little bit taken aback that we have to even do more exercise than what's
Yes.
normally. And
This was
I am not
another
hitting my
surprise for me.
235 minutes, I think is what you said per week. So
Yes,
I will now push myself to 235. I was really happy I
it
was at
is doable.
150. No,
Yeah.
it is. And what else do we have? We have to do it. So I think that,
Yeah.
and doing housework, I have told this to women, is not exercise,
Right, right. I
right?
mean, it is being active, but I think
It's
you
not,
have to push
yes.
yourself.
Because I say, well, was your heart rate going up? Were you sweating? And they're
Yeah.
like, no. I go, well, no, then that's not what we're looking for. I just had this conversation today with someone.
Uh-huh.
Um, and with respect to diet, I, and I will come back to this later because I know, Rupinder, sorry, I'm jumping on your questions and I'm
No,
dying for
no,
this
go
next
ahead.
question.
I think it's kind of exciting for me because these are questions I have had personally, right?
Okay.
Like, the intermittent fasting and eating more protein and how much strength training and how
Yes.
much like not even how much, but hearing from you, Dr. Syed, that this is more important for South Asians than for our Canadian counterparts makes me feel that we have a responsibility to ourselves to make
Yes.
sure we're doing these things so
Yes.
that we have a
We
longer,
have to
fulfilling
be.
life.
We have to
I
take
mean, agree.
responsibility. One question I had for you. Okay, with protein, I find in my patients there is a lack of protein, so I try to give them even in non-vegetarians and obviously vegetarians, or I'm really pushing that to increase that for their own
Yeah.
glycemic index foods and all that.
Hmm.
And then the other thing that is my biggest pet peeve, and I had a conversation with someone today who is diabetic and hypertensive, and she goes, oh, I have all this weight on my tummy, it's not going away, and she's 50 something. And I go, okay, well, we went through her exercise diet, and she goes, well, I think about exercising, and then the evening comes, and I just keep thinking. I go, well, I go, your
Yeah.
tummy's not going away on its own. Like, you got to do something. And then I asked
Right.
her what she ate. I'm being really good. I'm not eating sugar anymore. I go, okay, so what did you eat? Because I get into the
Yeah.
specifics. And she goes, I had cha, but I didn't put sugar. I put gur, which is
Oh, yeah.
unrefined sugar. So
Hmm.
this is my personal vendetta. It's like gur is sugar. You cannot think that gourd
Yeah.
is not sugar. Am I right,
Right.
Dr. Said?
No, you're 100% correct.
Thank you. Thank you.
So, sugar, I feel like, okay, gur, even if it's less refined, compared to white sugar, it's still largely sugar. And
Right.
it can raise your blood sugar significantly, cause an insulin spike and a blood sugar spike. I mean, if you had a glucose monitor to check it, even if you're a normal, healthy person otherwise of South Asian heritage, you will see a spike with gur, which is an unhealthy spike. And it it shouldn't get healthy low. It can be, you can get a really high glycemic response with jaggery or gur, just like with sugar, maybe a very minimally better, if at all, but less processed doesn't automatically mean low glycemic in any way with
Right.
gur.
Thank you.
Um, yep, and I will also mention that there has been I came across a study that compared the response to an identical amount of a sugary drink in South Asians, young, healthy South Asians, the response to their body of consuming this amount of sugar compared to a white Caucasian, same size body, same age, also young and healthy. And it's a very different response, by the way. Ours bodies, even if we're young and healthy, we produce a much unhealthier response to the same amount of sugar.
That's
Um,
amazing.
it's significantly, and this paper actually explained that this may be responsible for, because we produce a lot more fatty acids triglyceride levels, the lipemic response from consuming sugars is much higher. And this may be responsible for the rates of diabetes and heart disease that are higher in South Asians. They actually attribute it specifically to sugar.
So
Um,
sugar's really bad for us. What other foods are really bad for us
yeah,
compared to non-Indians?
no, great question. I would say surprisingly, um, I'm not saying we need to stop eating it, but like polished white rice, which is a huge part of a lot of South Asian people's diets, is actually a colonizer introduced food. It
Like
was not,
basmati rice?
I'm talking about white rice, like
Okay.
polished white rice, and basmati rice, I think, has a lower glycemic index than, say, polished white rice, um, or refined white rice, whatever you would call it. And this is like eating sugar.
Wow.
Yeah.
And if you're eating even more than a cup, you'll notice. I mean, I actually have tested it with a glucose monitor, and it surprises me how bad it can raise your blood sugar, and it also can keep it. By the way, I'm not diabetic, but I'm not even pre-diabetic, by the way. But I notice that when I eat, even a more than a cup of white rice, my blood sugar will be persistently elevated for hours. I mean,
So
it's not like in the diabetic range or anything like that, but it'd be like,
But how do you know
160.
your blood sugar is up if you're not measuring it?
Um, I actually have a glucose monitor that I do
Okay.
measure. I'm not diabetic. I have a continuous, you can get these over the counter in the United States. You don't have to be
but
prescribed them.
yeah. But Rupinder,
And
they're
I,
here for the
Mm.
Canadians who don't want to pay or don't want to have a
right,
monitor on. You can do a hemoglobin A1C, which
right.
Dr. Syed mentioned. So that's like a video of what your
Hmm.
sugar has been like for the last 3 months. In
Yeah,
addition to doing, a fasting blood sugar or a glucose challenge test or what have you. But that's sort of a reasonably good, I would think, way
yeah,
to sort of
totally.
assess a
It's totally
hemoglobin. So I
fine.
actually order it in all my South Asian patients, period.
Okay, well, that
Um,
Yeah.
question for you both then. Is there any way to tell if you are having a glycemic spike just by the way your body is reacting after you've eaten something? Can you just self-assess that or not?
I can actually, a lot of people can't. I can though. I can. For some reason I can tell because I get a little sleepy or tired.
Mm,
And I can actually notice it, and I've correlated with my
your
continuous
monitor.
glucose monitor, and
Yeah.
I can tell, oh yeah, this is exactly what's happening, and no wonder. Um, and either way, but in terms of going back to your other question, I would say high glycemic index foods, processed, white flour, white generally sugar and
mhm.
should be avoided, but high glycemic index foods and of course ultra processed foods should be
Yeah.
minimized because they're just horrible for your body. They're actually engineered to make you eat unlimited amounts of them.
Yeah, they make you addicted, like salts and sugars, and you just
Hmm.
want more and more.
They're
It's like when you
engineered.
start eating potato chips, right? Like
Yeah,
some
that's
people
what I
Yeah,
was
can't
thinking.
stop.
they
They just,
stimulate a bliss point in your brain,
yeah.
which is like a dopamine sensor. It's like a pleasure center.
That's me and
Um,
chocolate ice cream, so I try to avoid
yeah,
chocolate ice
exactly,
cream.
exactly. It's kind of like you can't stop once you've
It's
had.
almost like
Yeah.
a drug then rather than a food at that point.
Well, I almost think that it's been scientifically engineered to make you. I mean, it is. This is something
It
that's a
is.
known. The food
Yeah.
industry has done this.
The cereal industry is notorious for this, by the way. I
Mm,
was reading I
yep.
was watching a documentary on this. It's actually quite interesting. But getting back to your high glycemic, low glycemic index foods, I had a diabetic patient, and she's done an amazing job along with her medications of controlling her diabetes.
Yeah.
But what she did, one change that she made in her diet created a significant change in her hemoglobin A1C and her sugars. And that was she changed her flour that she would use to make roti. So
Oh,
instead of
okay.
using the regular atta that we buy, she used more millet flours. And
Millets. I
yes,
agree.
and I said, wow, I go, how'd you do it? I'm so proud of you. And she goes, well, this is the one change I made. And I was
Yeah.
shocked. It was like a huge change. So you agree?
Yeah, totally. I actually myself we've been eating millet breads, and you can have very tasty recipes for these.
Yeah.
You can, in fact, I would say I almost prefer them because they're equivalent, very close to wheat flour. They're delicious, actually.
Yeah, that's what she said too. So I think that's
And they're
something we
so
should
much
all,
better.
yeah.
And this is actually what a lot of the South Asian diet was before colonialism, was millet based, by the way. And I know the government of India is trying to bring them back because they don't require irrigation.
Oh, I did not know that.
Yes, it's so much better and it's so much healthier to eat the millets.
It's even better for the environment in a
And
way
it's
too,
so
then.
much better I mean, it's so much more sustainable. They don't
Yeah,
require irrigation. That's
that's
what's crazy.
amazing. That's
They can
Okay,
go
I'm
amazing.
gonna
naturally.
find out where we can get this from.
In pretty much any desi grocery
I
store,
think
you'll
anywhere
find
I've been there.
bags of
Yeah.
millet flour.
Yeah.
It's really quite available, as it should be, by the way.
You touched on pre-colonialism, and eating millet at that time, less so the refined wheat that we eat now.
Hmm.
This
And
relates
rice,
to,
by the way, white rice, polished white rice.
yeah, yeah, right. All the stuff that we think is
Yeah,
still Indian food, which is not really anymore,
yeah, I
not
mean, it's
compared to what it
almost
used to be.
engineered for us to eat something that was introduced by the colonizers because they owned all the rice mills and they were able to charge
Oh.
a huge profit by having us eat rice that was polished, even despite the fact that, it caused huge rates of very sadly.
Wow, wow. Um, in your book, you talk about how our ancestors had these agricultural traditions,
Yes,
and ways of farming and the kinds of food they farmed and the purity of it. And then once that shifted, once the colonizers, or the British came and
yeah.
changed things, our epigenetics changed as well. Can you tell us a little bit about epigenetics and how it factors into South Asian health issues?
Yeah. So, like you were saying, our ancestors had very stable, sustainable agricultural traditions and practices and crops that they grew, um, fit for, the land, adapted to the land they were growing. They even had their great, irrigation systems that were thousands of years lasting. All of this was disrupted because the agriculture was basically hijacked, and taxes were engineered so that you would only grow these cash crops. That was
Mm.
the only profitable way to pay your taxes because taxes were so high, they
Mhm.
were jacked up so high under colonial rule that the only way you could pay them was by growing these cash crops. And guess what? A lot of these cash crops were not food crops. So when food crops are no longer grown because your agriculture has been hijacked by a system that forces you to grow cash crops, you are no longer trying to feed the people. And all of this crops, they get exported for profit, and the entire food system changes, famines skyrocket, um, mass impoverishment is occurring at the same time. People can no longer afford to buy the food that is being grown. And so this is what's causing the famines. And what I came across this paper, this is what sort of, I read a paper in Nature about the effect of the Great Chinese Famine and how it creates a created a multi-generational effect on rates of diabetes and high blood sugar in even the grandchildren, more than double the rates in multi-generations of descendants after the famine. These are the famine survivors, of course. And I thought, wow, if this is what's happening after one famine, imagine a country that have survived at least 25 major famines, where
Unbelievable.
tens of millions of people dying. I mean, there was a study done by Jason Hickel that estimates that about 100 to 165 million excess deaths between 1880 to 1920 alone, probably all due to the famines that were the frequency of famines has skyrocketed. But the effect is epigenetics. Epigenetics is basically a survival mechanism that doesn't change the script of your genes, but it changes the expression of your genes. And this is what happens due to any environmental stress, specifically famines, especially famines. Your body rewrites how it expresses the DNA. And one of the manifestations is insulin resistance. Insulin resistance is actually a survival mechanism to help survive famines.
Mm-hmm.
And this is not just in South Asians, it's in any population, even in fruit flies. They've shown the same thing. If you starve fruit flies, they develop insulin resistance. All sorts of creatures do this as a survival mechanism. The mechanism is, so epigenetics is a very powerful mechanism, and it lasts multiple generations.
So if your
And
grandmother went through famine and her gene expression would have changed to so she wouldn't die during the famine,
Mhm.
that could get passed down to her child and then down to her grandchild, who might still
Right,
have insulin resistance.
That's
yes,
unbelievable.
and this is what in an environment of abundance,
Mm-hmm.
now this survival benefit, which is insulin resistance, becomes a catastrophe. Because I mean, I shouldn't say it's a catastrophe, but it's something that causes this health crisis where you have diabetes and heart disease and all sorts of other. So this is why we have to be extra careful. I'm not saying I think we can manage it. We just have to be extra careful with our body, extra accountable. There's a way around it. I think that we can manage it, but with the knowledge that we have, and I want everyone to know, and I know Dr. Madhu also wants people to know the same thing. Um, it's possible to circumvent or avoid all of this with the right lifestyle changes.
So let's talk about that. I just want to, I guess, ask two questions. One, I think I want to reiterate again afterwards what tests we need to do as South Asians. But let's
Yeah.
start with, what do we need to do in our lifestyle so
Mhm.
that we can control whatever we can control?
Yeah, no, excellent question. I think, for instance, we talked about diet changes. I would say definitely increase the fiber in your diet.
Yeah.
That definitely avoids the spikes. The one thing that I do, in terms of also as another thing is I try to have the fiber and the vegetables first, then the protein, and then lastly the carbs. Um, it does have some effect in reducing your spikes. Um, the other thing is I would definitely recommend strength training at least 2 to 3 times a week, because muscle is like your glucose sink.
Mm.
It'll absorb glucose and it'll reduce your insulin resistance. Post-meal walking, like at least 10 to 20 minutes after, especially after your last meal of the day. I know it's hard, but maybe even try to make it a family or couple event or some type of social event with someone that makes it easier, to try to make it like a thing that you always do after a meal. Um, keep, in terms of portion size, that keep the roti and the rice, reduce the portion so they're not excessive. Pair them with protein and fiber. Uh, try to, have lower GI or glycemic index foods as much as possible. Um, avoid ultra processed foods, um, much more than than you probably do currently. Fast food is also in the same category. Um, we talked about exercise, trying to maintain at least 230 minutes of moderate intensity exercise a week, uh, to match the cardio, to maintain the same health as someone who's probably of white European heritage who exercises 150 minutes a week. We need to do more. Um, So those are just some thoughts. I'm sure there's so much. I mean, I would say pay attention to your sleep also. Try to get like close to 8 hours of sleep as much as your body needs really to feel rested. And the other thing that I've come across is if you're not getting enough sleep, or maybe you're sleeping but you're not feeling rested, and perhaps you're still feeling tired, or even you're feeling sleepy during the daytime. South Asians have like twice the risk of sleep apnea,
Yeah,
and we
I
should
saw a
get
lot of
tested for
people for
that.
that. Yeah, and the other thing is, just want to mention quickly, a lot of people don't believe their blood pressures are high, and they'll say, no,
Oh
no, it's
yeah.
just high at the doctor's office. So
Mhm.
encourage them to buy a blood pressure cuff that they can
Yep.
do at home, and they log and give it to you. Or what I've been doing along with the sleep apnea testing for my patients is doing a 24-hour ambulatory blood pressure so that they can see themselves over that 24-hour period that no, in fact, it is. And interestingly enough, those that with sleep apnea, sometimes the blood pressures will also spike at night because they're not getting enough
Oh yeah,
oxygen or
for
breathing
sure.
properly. So it's actually, there's testing, but as
Hmm.
physicians, we have to advocate. And today we're trying to get our patients to advocate by educating them. So thank you so much for all the wonderful tips.
Yep. The other thing I would highly recommend is dental or oral health is very
Yeah.
Mhm.
important. It's often not mentioned, but this is a very critical, crucial part of your health.
Can you explain
And
why?
yes, this is a cause, a lot of South Asians may have periodontal disease, and they may not even realize it. And they need to go to a dentist to get evaluated and get their teeth cleaned if necessary. But the most important thing you can do is to floss every night, brush your teeth and floss every night if you can. And can avert the inflammation. It can avert things like heart disease. They found actually people who are having heart attacks, a lot of them actually have the bacteria found in your gum disease, periodontal gum disease bacteria inside those clots within their coronary arteries.
Yeah,
Um,
that's right. Yeah.
and even inside brains, by the way, of people who have what were thought to be dementia, Alzheimer's disease.
Wow.
Good thing I went to my
Enlightening.
dentist the other day.
Yeah,
These are some great tips of what you've suggested of what we can do for our own health. There's been talk about creatine. Is that something that you would add to that list of how we can support ourselves?
yeah. So I think it's reasonable for many adults to support strength training and muscle mass. There has been some good evidence to support the safety within standard dosing. Um, and there's, perhaps some other benefits in terms of glucose metabolism alongside exercise. Um, and I would, in addition to creatine, you probably want to make sure, first of all, that your vitamin D level is normal. Make sure you take vitamin D if it's not.
Mm-hmm.
Um, and they've even found that that can actually reduce your heart attack risk or your cardiovascular disease risk if your vitamin D level is low and you supplement it. There was a recent article saying that that can actually benefit you or be preventative for you. Um, if you have a low intake of vitamin B12, you may need to take vitamin B12. And that can actually be helpful to prevent homocystinemia or hyperhomocystinemia, one of the risk factors for heart disease, by the way. Even if you're perhaps if you're vegetarian, you may want to check that, especially.
Mm-hmm.
But even routinely, you should check it actually.
Yeah.
Um, and then if omega-3s can be helpful if your triglycerides may be elevated, but that's something that you probably want to discuss with your physician.
Mm-hmm. Those are some really good tips.
Yeah,
I feel like I've learned a lot from you
Mhm.
today, and I feel like and I've already been following you on Instagram. And for those of you who are not following Dr. Syed, you can find him at DesiDoc.md on Instagram. Goodness, that was a bit of a mouthful.
yeah, sure.
Um, and you also have a book, two books,
Yes.
right? Why don't you tell us
Um,
about that?
yes, I have a book that is currently out. It's about the my deep dive into the history of what caused the famines, I felt like I had to understand for myself how, South Asia, which was the richest country or the richest region on earth with 25% of the world's GDP,
Mm,
uh, the richest country by far, by the way, in
yeah.
terms of wealth, was transformed into the poster child for poverty within less than 200 years, and how it became the land of famines, where famines were pretty rare before, colonization, and they spiked to over 25 in major famines in that period. And I wanted to understand how this impoverishment occurred and how it was so systematic, and you know, how this tragedy really happened. This huge transfer of wealth. We're talking about $66 trillion US, 2020 US dollars that was systematically extricated. The whole country was deindustrialized. It was a leader of technology, leader in shipbuilding, steel making, textiles. It was a massive deindustrialization that occurred, and mass impoverishment, that I think we should all know just as part of our knowledge, because it's not really talked about. The
No.
famines, I mean, we don't really never hear about the famines. Even in the history books in India, they don't hardly mention in fact, they don't mention the famines.
You're right. I did not realize that there were that many
It
famines
was
until you
such a
told
huge
me.
tragedy. Mahatma Gandhi said this is one of the greatest crimes against humanity ever committed. That's in my preface to the
Oh,
book.
I
Um,
can't wait to read your book.
yeah,
This is
me too.
fascinating. I mean, I love history in general, but the fact that it applies to us as South Asians and how we've
because
evolved or grown
it
through it, right?
affects us today. That's
Yeah,
Yeah,
it's
why
our
it's so
personal
important
health.
to
our
know
history
this.
affects our health, right? Like this
Yeah.
is fascinating.
It's
Um,
why I wrote the book, because there's such a huge connection between the epigenetics of what these famines created within a generation and affected our, you know,
And how it's playing out to date.
how it's playing out today. Exactly.
Yeah. So
It's a
thank you for that.
health crisis. Yep.
Yeah. Thank
we
you.
we have really appreciated you taking the time to come on here. Our friend from south of the border, everybody, Dr. Mubin
Thank you.
Said, thank you so much for your insights, for sharing your information with us. And I look forward to seeing more of you on desidoc.md on Instagram. And I'll definitely be reading your book. And if anybody has any
Thank you so
questions
much.
for us, please DM us with them. We look forward to hearing from you. And we'll keep in touch with you, Dr. Syed. Thank you so much.
Okay. Really
Thank
appreciate
you.
it. Thanks so much for having me.